Hello, my name is Ken Thorne, and I present to you today my presentation on hypercholesterolemia. In hypercholesterolemia, there is a problem with the LDL receptor, or it is without the receptor. Uptake of cholesterol into the liver is not possible. The liver usually processes two-thirds of the circulating LDL. Hundreds of mutations of the LDL receptor have been identified which express themselves as hypercholesterolemia. Signs and symptoms of hypercholesterolemia are high cholesterol often has no symptoms. The damage may be done before you notice anything is wrong. Some of the signs and symptoms are chest pain when you are doing certain activities, or xanthomas, which are fatty deposits often found in tendons and on the elbows, buttocks, and knees. Cholesterol deposits around the eyelids, which are xanthomas that occur around the eyes, also known as xanthalamus. Xanthalamus. Gray-white cholesterol deposits around the corneas, also known as corneal arcus. Corneal arcus. Major risk factors for the development of hypercholesterolemia. High cholesterol can be defined as LDL cholesterol greater than 160 milligrams, with one risk factor of greater than 130 milligrams, with two cardiovascular risk factors. The important risk factors include age, males 45 years or older, females 65 years or older, a positive family history of premature atherosclerotic cardiovascular disease younger than 55 years in a male and younger than 65 years in a female. Hypertension, low HDL cholesterol levels less than 40 milligrams in male and less than 55 milligrams in female. More major risk factors for the development of hypercholesterolemia is a poor diet, eating saturated fats found in animal products and trans fats found in some commercially baked cookies and crackers, and microwave popcorn can raise your cholesterol level. Foods that are high in cholesterol, such as red meat and full fat dairy products, will also increase your cholesterol. Obesity, have a body mass index of 30 or greater puts you at a risk of high cholesterol. Lack of exercise helps boost your HDL or good cholesterol while increasing the size of the particles that make up the LDL or bad cholesterol, which makes it less harmful. Smoking. Cigarette smoking damages the walls of blood cells, making them more prone to accumulate fatty deposits. Smoking might also lower your level of HDL or good cholesterol. Because of your body's chemistry changes as you age, your risk of high cholesterol climbs. For instance, as you age, your liver becomes less able to remove LDL cholesterol. Diabetes. High blood pressure contributes to high levels of dangerous cholesterol, called very low density lipoprotein or VLDL, and lower HDL cholesterol. High blood sugar also damages the lining of your arteries. Epidemiology: prevalence of hypercholesterolemia in U.S. adults. According to the Centers for Disease Control and Prevention, or the CDC, 7.35 million or 31.7% of adults in the United States have high levels of LDL-C and are at twice the risk for heart disease than people with normal levels. Only 48.1% are receiving treatment to lower LDL-C levels. Recent data suggests that the classic disorder, familial hypercholesterolemia, has a prevalence of 1 out of 300,000 of homozygous and 1 out of 250 as a heterozygote. In certain populations such as the French Canadians, Lebanese, and Afrikaners, it could be as high as 1 out of 100. The highest level of LDL cholesterol amongst U.S. males occurs in Hispanic males at 13.1, followed by African Americans at 10.9 and white males at 10.6. Overall, elevated LDL-C is more common in females than in males. The highest level of LDL cholesterol occurs in U.S. females or white females at 14.8, followed by African American females at 10.3, and Hispanic females at 9. Complications with hypercholesterolemia. High cholesterol can cause a dangerous accumulation of cholesterol and other deposits on the wall of your arteries. These deposits can reduce blood flow through your arteries, which can cause complications such as chest pains. If the arteries that supply your heart with blood, which are the coronary arteries, are affected, you might have chest pain and other symptoms of coronary artery disease or heart attack. If plaque tear or rupture, a blood clot can form at the plaque rupture site, building the flow of blood or breaking free and plugging an artery downstream. If blood flow to part of your heart stops, you will have a heart attack, stroke, Like a heart attack, a stroke occurs when blood clots blocks blood flow to part of your brain. In the registry-based study, 4,688 males and female patients from the unit of for cardiac and cardiovascular genetics registry was verified molecular genetic diagnosis familial hypercholesterolemia in the period between 1992 and 2010 were linked to the Norwegian cause of death registry. Standardized mortality ratios and 95% CIs were estimated. There were 113 deaths. Mean age of deaths was 61.1 years. Cardiovascular disease was the most common cause of death, which was 46%, followed by cancer at 31.1%. Compared with the Norwegian population, cardiovascular disease mortality was significantly higher in the UCCT registry in all age groups younger than 70 years. No significant differences found in all-cause mortality or cancer mortality. Barriers and strategies to overcome the barriers. Chest pain. You can For chest pain, you can take medications which include nitroglycerin, and other medications that open partially closed arteries, plus clot busting drugs or blood thinners. Heart attack. Stop smoking and minimize your exposure to secondhand smoke. Get your high blood cholesterol and high blood pressure under control by modifying your diet, lose weight, take medication, or doing a combination of these things. Stay physically active daily. Control your weight if you're overweight or obese. If you have diabetes, take care by sticking to your treatment plan and managing your blood sugar. Some more barriers to strategies to overcome barriers are control your blood pressure, quit tobacco, control diabetes, manage a healthy weight, eat a diet rich in fruits and vegetables, exercise, drink alcohol in moderation, treat obstructive sleep apnea, avoid illicit drugs, and manage other medical conditions. Prevention and treating. The same healthy treat the same healthy lifestyle change that can lower your cholesterol can help you prevent you from having high cholesterol in the first place. To help prevent high cholesterol, you can eat a low salt diet that emphasizes fruit, vegetables, and whole grains. Limit the amount of animal fats and use good fats in moderation. Lose extra pounds and maintain a healthy weight. Quit smoking. Exercise on most days of the week for at least 30 minutes. Drink alcohol in moderation if you drink alcohol, and manage your stress. In conclusion, I learned that hypercholesterolemia affects the way the body processes cholesterol. As a result, people with Hypercholesterolemia have a higher risk of heart disease and greater risk of early heart attack. The condition is present from birth. Therefore, being active, watching your video and watching your diet and controlling your weight will decrease your chances of developing hypercholesterolemia. And this sums up my research on hypercholesterolemia. Thank you.